Hi, I'm Dr. Nina Watson. I'm board certified diagnostic radiologist, breast cancer doctor. I help busy people learn how they can start and how they can maintain a healthy lifestyle. So maybe you've scheduled your first mammogram and you're not quite sure what to expect. Or maybe you've had mammograms before, but you're not quite sure what they were doing. So I would like to address 3 questions with you. How you should prepare for your mammogram, how the procedure is performed, and what you can expect during the procedure. So before scheduling your mammogram, it's important to talk to your doctor and let them know any new findings, any new problems that you're having with your breasts. You would also want to discuss with them and make certain that they are aware of any prior surgeries that you've had, any hormone use, if you have a family history of breast cancer, or if you have a personal history of breast cancer. The timing of your mammogram is important. It's best to have your mammogram performed 1 week after your period, your menstrual cycle. If you schedule 1 week prior to your menstrual cycle, sometimes this can be the time when your breasts are the most sensitive, and if this is the case, it can make the exam more uncomfortable. So other things are to remember is that when you come for the exam that day, you don't want to wear any deodorant, any lotions, any powders on your breast. These can actually show up on the images of your mammogram and cause artifact. You also want to make certain that you describe any problems or any symptoms that you're having with to the technologist so that they are aware. If this is the first time that you have come to this location for your mammogram, you want to bring copies of any prior mammograms with you because the way the radiologist, the doctor who reviews the mammogram, will look at comparisons to be able to pick up on any small changes in your breast tissue. One thing that is very important is that you want to ask when your results will be available. You don't want to just assume that if you don't hear anything that the results are normal. You want to make certain that either your doctor or the facility informs you that your mammogram is normal. Now, the mammogram is normally performed in an imaging center, and during the exam, the technologist will position your breast on the mammogram unit. Your breast will be placed on a platform, and it will be compressed between 2 clear plastic panels. Pressure will be applied, and this compression will help to even out the breast tissue. This is important for a number of reasons. It makes certain that all of your breast tissue is evaluated. Also, if there are very small little abnormalities in the breast cancer, in your breast, it helps for it to be seen. Also, the spreading out of the breast tissue actually reduces the amount of radiation that your breast tissue is exposed to, and it also helps to reduce motion, which could make your mammogram unreadable. Now, you'll be asked to change positions, and 2 images will be taken on each breast, and that will be for a total of 4 images. Now, during the time where the images are being taken, it's very important to try to remain as still as possible. You don't want to have any blur in the images, which could again make the images unreadable. Now, what will you experience? What will you experience while the mammogram is being performed? So while your breast is between the 2 paddles and the pressure, the paddles are being squeezed, you will feel some pressure on your breast. Now, some women, if they, go maybe the week prior to their menstrual cycle, prior to their period, they could experience some sensitivity or discomfort. If you're experiencing any significant sensitivity, definitely inform the technologist and let them know so that they can use less compression. But just remember, compression is important for multiple reasons. It helps to reduce motion. It reduces the amount of radiation your breast tissue is exposed to. It also helps to spread out the breast tissue to make certain that all your breast tissue is evaluated, and if there is a small little abnormality there, that it can be picked up and can be detected. So again, this is Dr. Nina. I'm a board-certified radiologist, breast cancer doctor, and I help busy people learn how they can start and how they can maintain a healthy lifestyle. If you want to learn more, you can follow me on Facebook at www.facebook.com/Dr. Nina Watson. That's DrNinawatson.